midwife is in Alberta a regulated health professional that provides holistic care to women throughout their pregnancy, birth and postpartum.
The requirements for a registered midwife here in Alberta is to complete a 4-year baccalaureate program. There are several education programs in Canada. Some midwives come from other countries and are able to challenge the requirements, write exams and prove their skills in order to be able to register here. Every year a midwife needs to recertify in neonatal resuscitation. So that means going through 4 hours of continuing education to make sure that we're able to respond to emergencies for babies both in the hospital and outside the hospital. As well, we recertify CPR, basic life support skills, and every 2 years we do an emergency skills recertification. So looking at managing emergencies like hemorrhage, a breech baby that was unexpected at home, unexpected twins, several emergencies that would call on your ability to manage a crisis until we can get to that next level of care.
The Canadian model of midwifery practice is based on certain pillars and common beliefs that midwives in Canada have. Birth is a normal, natural process. We also believe in continuity of care. That means a woman has access to her midwife or her midwifery team 24/7 throughout her pregnancy, birth and postpartum. Another one is informed choice, and this is very, very important for midwives. It means that every woman has a right to have all the information and choose the care that's appropriate for their family.
Midwives are autonomous care providers, and what that means is on our own responsibility, we may order tests, interpret the results of those tests, look after a woman and her baby during the course of the pregnancy, through her labor and birth. There is no requirement for a physician to be involved in a straightforward pregnancy and uncomplicated labor and birth. Evidence-based practice in midwifery means using the best available information and research to support the care that we provide to women, and it also gives us an opportunity to discuss with them what those options might be so that they can choose a way through their pregnancy that feels both safest and most comfortable for them. Not every woman comes to pregnancy with the same idea of what is safety or where their line in the sand is as far as comfort. So we're able to help guide them to the latest available research so that we can help them find a way that's going to work best for them.
For low-risk women, we support women's choice for birth in the home or in a birth center or the hospital.
Choosing to give birth in hospital is sort of a traditional concept for most people. And for many women, their choice to give birth in hospital is to comfort their partner, their family, because that's where they want to give birth. They feel that they're in an area where there's lots of help if things go wrong. Giving birth at the birth center, for many people, they don't have to worry about tidying up their house, about people around their house or their condos or apartments. And finally, for home, many people feel safest at home and they don't want the travel to give birth and to get back home, and so they choose to have their baby at home.
We need options for people. So some people want to deliver in the level 3 NICU, everything is available. Other people want to deliver at home, and those options should all be available.
Midwives work with many different health professionals, and not just physicians and nurses, but also physiotherapists, acupuncturists, etc. We're very fortunate that we've developed some good relationships with our experts, our pediatricians and our obstetricians, and in some cases the internists who need to see somebody who maybe has a heart murmur that's never been investigated. So we'll arrange those kinds of things for the women that we take care of.
The value of midwifery is to augment letting people have the kind of birth they want to have.
I would say majority of women are indeed low-risk women. In fact, majority of women should qualify to be under care or care of midwifery.
Midwives provide wonderful services, very comprehensive, caring, thorough care for women
Midwives and obstetricians in Calgary generally, I think, have a great relationship. We really, from an obstetrical perspective, we really respect the midwives that we have here. We respect their training, we respect their experience and the relationships that they have with their clients.
The work that midwives do is extremely important in terms of promoting holistic birth and providing healthy choices for women. My research around midwifery was that the women were way more likely to be satisfied if their provider was a midwife.
The outcomes are very good with midwifery care. There's been lots of research done. In Alberta, one of the main outcomes that we are very, very proud of is our low C-section rate. It is 7%, and the World Health Organization recommends that it be below 15%, so we are very happy with that rate. Another one is our low intervention rate. We know that in birth, many times if we step back and don't intervene, birth works. So that's one of the benefits of midwifery care. Another one is a shortened hospital stay. So women are able to have birth in the hospital, go home quick. One of the benefits in research is that it helps with breastfeeding as well. Our breastfeeding rates are quite high because we support the normal process and do a lot of education and help in the first couple of weeks when some women have problems getting started on breastfeeding. And we know that there's long-term benefits for breastfeeding in infancy.
For me, that it comes back to strengthening mothers and their families, how they define their families. And in most cases, I think that midwives can play a huge role in doing that.
From a dad's perspective, midwives are necessary. They're amazing. I appreciate the midwives for the attention to detail and support for young and inexperienced parents.
I wanted my pregnancy to be as special to the people that were supporting me in it as it was to me. It mattered how I brought my baby into the world, and it matters, this matters, and it's gonna matter for years to come in his life.